What would you do if you discovered that your dog is losing its memory and you didn't even notice? Many pet owners think their dogs are just aging naturally, when in reality they might be facing something devastatingly similar to human Alzheimer's. Today, we're going to explore a silent epidemic that's affecting millions of elderly pets around the world and why most cases go completely unnoticed until it's too late. By the end of this video, you'll understand exactly how to identify the first signs of this condition, why it's so frequently misdiagnosed, and what you can do to protect your four-legged companion. But before we begin, please leave in the comments your name and the city where you're watching our content from. Let's start with a shocking reality. Recent studies show that up to 68% of dogs at 16 years old show at least one sign of canine cognitive dysfunction, a condition neurologically similar to human Alzheimer's. But here's the most alarming fact. Although 14% of dogs over 8 years old are affected by this condition, only 2% receive the correct diagnosis from their veterinarians. This means that millions of dogs are suffering in silence, while their owners attribute worrying behavioral changes to normal aging. But what exactly is this condition that's going unnoticed? The canine cognitive dysfunction, known by the acronym CCD, is a neurodegenerative syndrome that affects the brains of elderly dogs in a surprisingly similar way to Alzheimer's in humans. Let's explain it simply. Imagine the brain as a giant library where each book represents a memory or learned skill. Over time, this library begins to deteriorate, books disappear from the shelves, and the organization system becomes confusing. In the brains of dogs with this disease, something similar happens. Neurons begin to die, important connections break, and toxic proteins called beta-amyloid plaques accumulate, exactly like in human Alzheimer's. The result is a progressive loss of cognitive functions that goes far beyond normal aging. The most common signs include confusion and disorientation, even in familiar places. Your dog might get lost in its own backyard or not recognize the front door of the house. Dramatic changes in sleep patterns are also frequent, with dogs sleeping during the day and becoming agitated during the night. Social interaction decreases drastically. Some dogs stop greeting their owners or hide when visitors arrive. Loss of learned habits is another worrying sign. Dogs that never had accidents inside the house might start having accidents, and basic commands they knew perfectly might be forgotten. Unexplained anxiety, excessive vocalization, and changes in physical activity are also part of the clinical picture. But here's the big problem. Why do these signs go unnoticed? The answer lies in our perception of animal aging. When a 12-year-old dog starts sleeping more, the first reaction is to think this is normal for its age. When it becomes less active, we assume it's arthritis. When it stops responding to commands, we think it might be hearing loss. This confusion happens because many medical conditions can mimic the symptoms of cognitive dysfunction. Vision problems can make a dog seem disoriented. Arthritic pain can decrease social interaction. Thyroid problems can affect sleep patterns. And it's exactly for this reason that canine Alzheimer's is considered a diagnosis of exclusion, only being confirmed after other problems are ruled out. Another crucial factor is that most veterinarians don't use specific tools to assess cognitive function during routine consultations. Unlike standard physical exams, cognitive assessment depends mainly on detailed questionnaires and behavioral observation, something that rarely happens in quick consultations. Let's now explore why we're calling this a silent epidemic. In the last 40 years, the life expectancy of dogs has practically doubled. If before a dog lived an average of 6 to 8 years, today many reach 12, 14, or even 16 years. This increased longevity means that more dogs are living long enough to develop age-related diseases, including cognitive dysfunction. Studies show that the prevalence of dementia in dogs increases exponentially with age. In dogs 8 to 11 years old, about 8% are affected. This number jumped to 18% in dogs 11 to 13 years old, 45% in dogs 13 to 15 years old, and an impressive 67% in dogs 15 to 17 years old. Above 17 years, 80% of dogs show some degree of cognitive impairment. To put this in perspective, imagine we're talking about millions of animals globally. In the United States alone, with a canine population of approximately 90 million, this means that potentially 12 to 15 million dogs might be dealing with some degree of cognitive dysfunction right now. But the situation becomes even more worrying when we consider that many pet owners don't report behavioral changes to veterinarians. Research shows that 75% of elderly dogs show at least one behavioral change suggestive of cognitive dysfunction, but only 12% of pet owners report these changes during veterinary consultations. The comparison with human Alzheimer's is impossible to ignore. Both conditions share fundamental neurological characteristics. In both cases, we see accumulation of beta amyloid plaques in the brain, neuronal degeneration, brain inflammation, and impairment of the blood-brain barrier. The progression is also similar. It starts subtly, worsens gradually, and eventually drastically impacts quality of life. In fact, dogs with cognitive dysfunction have become valuable research models for understanding human Alzheimer's. Studies with dogs have contributed to the development of new treatments and prevention strategies that benefit both animals and humans. This demonstrates how close these two conditions really are. Now let's talk about what makes diagnosis so challenging. First, there's no specific test that confirms canine cognitive dysfunction. The diagnosis depends on behavioral questionnaires, clinical observation, and exclusion of other medical conditions. This means the process can be time-consuming and requires veterinarians specifically trained to recognize the signs. Second, many other conditions can perfectly mimic the symptoms of canine Alzheimer's. Kidney diseases can cause confusion. Heart problems can decrease activity. Brain tumors can affect behavior. Each of these possibilities needs to be investigated before a cognitive dysfunction diagnosis is confirmed. Third, there's a cultural resistance to accepting that animals can develop dementia. Many pet owners, and even some veterinarians, still see behavioral changes in elderly dogs as an inevitable part of aging, not as a treatable medical condition. Diagnostic tools are being developed to improve this situation. The Canine Dementia Scale, known as CADES, is a validated questionnaire that evaluates 17 specific behaviors in 4 main domains: spatial orientation, social interactions, sleep cycles, and elimination control. High scores on this scale correlate strongly with the presence of cognitive dysfunction. Researchers are also working on blood biomarkers to detect the condition earlier. Specific proteins in the blood, like neurofilament light chain, show elevated levels in dogs with cognitive dysfunction, offering the possibility of more objective diagnoses in the future. The impact of this silent epidemic goes beyond the dogs themselves. Recent studies show that 16% of pet owners of dogs with cognitive dysfunction experience a clinically significant care burden, similar to what family members of people with Alzheimer's face. The quality of life of both the animal and the family is drastically affected. Many pet owners report feelings of frustration, sadness, and even guilt for not being able to help their dogs. Sleep disruption, accidents at home, and behavioral changes create chronic stress that can affect the entire family dynamic. Some dogs become aggressive or anxious, further complicating the situation. So, what can pet owners do to protect their dogs and identify problems early? Step number 1. Pay attention to the signs. Keep a behavioral diary if your dog is over 8 years old. Note changes in sleep patterns, social interaction, spatial orientation, and elimination habits. Small changes that persist for more than 2 weeks deserve veterinary attention. Step 2. Education is fundamental. Learn about the specific signs of cognitive dysfunction and don't automatically accept that behavioral changes are normal for age. Question, investigate, and ask for detailed evaluations if necessary. Step number 3. When consulting the veterinarian, bring specific information. Instead of saying your dog is acting strangely, describe specific behaviors. It stood staring at the wall for 10 minutes or stopped recognizing its food bowl. Details make all the difference in diagnosis. Step 4. Consider regular cognitive evaluations for elderly dogs. Just as we do annual physical checkups, behavioral evaluations can detect problems before they become severe. Many veterinarians now offer specific questionnaires for cognitive dysfunction. Early detection is crucial because although there's no cure for canine cognitive dysfunction, there are treatments that can slow progression and significantly improve quality of life. Medications like selegiline can help preserve brain function. Diets enriched with antioxidants and omega-3 fatty acids have shown cognitive benefits. Supplements like SAMe, vitamin E, and specific compounds can support brain health. Environmental enrichment is also fundamental. Mental games, new toys, regular exercise, and consistent social interaction can help keep the brain active and delay cognitive decline. Maintaining consistent routines reduces anxiety and confusion. Awareness about this silent epidemic needs to increase. Every pet owner who learns to recognize the signs can save their dog from years of unnecessary suffering. Every veterinarian who implements cognitive assessment protocols can diagnose cases that would previously go unnoticed. We need to change our perception about animal aging. Just as we no longer accept that confusion and memory loss in elderly humans are normal, we shouldn't accept this in our dogs. They deserve accurate diagnoses, adequate treatments, and the best possible quality of life during their golden years. Research on canine cognitive dysfunction is advancing rapidly, offering hope for the future. New treatments are being developed, biomarkers are being refined, and our understanding of prevention is constantly improving. Dogs diagnosed today have many more treatment options than those from just a few years ago. The parallel with human Alzheimer's research continues to benefit both species. Discoveries made in canine studies contribute to human treatments, and vice versa. This scientific collaboration is accelerating the development of solutions for both affected populations. As our awareness campaigns expand, we're seeing positive changes. More veterinarians are implementing cognitive assessment protocols, more pet owners are reporting behavioral changes during consultations, and more research is being funded to better understand this devastating condition. But there's still much work to be done. The silent epidemic of canine cognitive dysfunction continues to affect millions of dogs and their families. Every undiagnosed case represents a lost opportunity to improve quality of life and delay disease progression. The solution starts with you. If you have an elderly dog, start observing their behaviors more carefully. If you notice changes, don't hesitate to consult your veterinarian with specific information. If you know other elderly dog owners, share this knowledge with them. Together, we can transform this silent epidemic into a widely recognized and adequately treated condition. Our dogs depend on us to identify when something is wrong and seek the necessary help. They've given us years of unconditional love and loyalty, and they deserve that we do everything in our power to protect their brain health and quality of life during their golden years. Canine cognitive dysfunction no longer needs to be a silent sentence. With knowledge, vigilance, and adequate veterinary care, we can offer our canine companions the dignity and comfort they deserve, regardless of age. The first step is recognizing that behavioral changes in elderly dogs aren't always normal, and that our four-legged friends deserve the same specialized medical attention we offer to the human members of our families.